Hi, I'm Dr. David Camfield. I'm a cognitive neuroscientist at University of Wollongong, and we're doing a study looking at biomarkers for major depressive disorder. The main focus of our research is looking at electrophysiology, which is also known as EEG, so measuring people's brain waves while they do some computerised tasks and try and differentiate the brain waves of people with depression from healthy people without depression. What we're aiming to achieve is to identify specific patterns of brain activity associated with depression so that we can use that to improve diagnosis and treatment for people with the disorder. Having an objective test of depression would help with reducing stigma around the disorder, purely because people are always second-guessing themselves when they have depression. They're not entirely sure whether they're just needing to toughen up a bit and deal with their problems more successfully, or whether they've actually got something really wrong with them. And that's where an objective test would really help, that it could eliminate the guesswork. People can say, oh, obviously from the results of this test there's something wrong and I need to get it fixed. Another goal of this research is to develop personalised treatments. Currently, the research suggests that there's lots of different causes of depression, and it's not always immediately apparent which is the underlying cause for each individual. That's why a number of different antidepressants or talk therapies are required until the patient arrives at something which works for them. So what this technology could achieve is to find a way of arriving at what is the best personalised treatment very early on by looking at the specific signature of brain activity, and that being a signpost to what the underlying cause is. So what's involved for the participants when they arrive is we first get them to fill out a number of questionnaires, which are clinical rating tools for depression and anxiety, and then after that we measure their electroencephalography using a 32-channel EEG system, which is basically a lycra electrode cap with electrodes in it, which is fitted to their head. And in addition to this, we also measure their skin conductance response, which is similar to a lie detector test. So when they are connected up to the electrophysiological recording equipment, we give them a number of standardised computerised tests involving auditory stimuli, visual pictures that are highly emotional in nature, and we also administer a loud acoustic stimuli which is designed to elicit a physiological response and look at their autonomic responses to that as well.